Thank you so much for the opportunity to talk with you. Yes, we've sort of come to the end of this project just a few weeks ago, and are really excited to be able to share the results reasonably widely. We haven't yet written this up for publication, but that will be the next phase, as well as a policy brief. So really keen to get feedback at this stage as well. It's not too late to have your input. So at the end, perhaps we can have a discussion around that. So the project was co-led by myself and a colleague, Kahurangi Dey, and we were aiming to look at food insecurity in people with MECFS and or long COVID. It wasn't just the two of us, so we had three research assistants who helped along the way. We had Josie Butler, who has got lived experience of long COVID and is also trained as a nurse, so she was superb to help us make sure that our questions were right and helped disseminate the survey and did some of the interpretation as well. And then we had two students, Taylor, who worked with us really briefly, and my daughter Isabel, who's helped with some of the analysis. But obviously huge thanks goes to the participants, really aware that we ask a lot of people who have got clearly limited energy and often have cognitive dysfunction as well. So it's, and we couldn't do the work without the kind of input that we've had. And we're very grateful to ANSMES who funded the work. So our initial aim was to identify how common food insecurity is. That was that stemmed from a research interest that Kahurangi has got in food insecurity, and so I was, doing various bits of work and obviously have lived experience of ME, and so we used to share an office. We were just having a chat, and I thought, oh, that'd be quite an interesting project. So we designed a survey very much based on the food insecurity questions in the New Zealand Health Survey, and piloted it with 10 people. But through the results of the pilot, we realized there was an awful lot more to adequate or optimal food and nutrition in people with ME beyond cost, which is what most of the questions that the New Zealand Health Survey used to measure food insecurity. They really focus on cost. So affordability clearly was an issue, but there was lots of people talked about the need for specialized nutrition, the difficulties with food preparation, and just the in general challenges of nutrition while having a chronic illness. So from that pilot, we broadened out our questions to include a whole variety of other questions as well as quite a few places where people could tell us their stories. So we got a lot of qualitative feedback, and I'm going to present to you not only the statistics, so the results of the quantitative survey, but also some quotes that people people gave to us, and they sort of give a real understanding, I think, of what's going on in people's lives beyond the numbers. So we designed this as an online survey that was made available through Qualtrics. It was disseminated through yourselves and many other ME and long COVID networks, and it was available from May through to the beginning of September this year. We had responses from 334 people with either ME/CFS and or long COVID, and you can see that it's just under a third of people identified as having both. We included people who said that they had these conditions and or had been diagnosed with one of these conditions by a health professional. There weren't very many people with long COVID but not ME, so only 12%, and nearly 60% had just ME but not long COVID. There were a range of severities included, so I assumed that most of the people who were going to answer would probably have mild illness, but actually over half had moderate illness. Again, a big chunk had mild, and we were really lucky that some people with severe and very severe illness had the capability and or the support to answer the survey, so that we've got some understanding of what nutrition or food obstacles people with severe and very severe illness face. Most of the participants were New Zealand European or European, and 6% were Māori. So first of all, looking at the food insecurity questions, about exactly half of participants had experienced cost-related food insecurity in the past 12 months. So as I mentioned then in the New Zealand Health Survey, which is thought of as kind of the gold standard of understanding food insecurity in New Zealand, there are 6 questions that measure cost-based accessibility to food. So the first question is framed backwards. It's defined as, so people are asked whether there are times that, or how often they are able to afford to eat. And so we defined food insecurity as sometimes or never being able to afford to eat. And then the other questions are framed in the other direction. So we defined cost-based food insecurity as sometimes or always due to cost, having food run out, eating less because of cost, eating less variety because of cost, relying on others to provide food because of cost, or using food banks or specialised food grants. So overall, that was half of people. And when we looked by severity, then going from mild to moderate to severe, the more severe somebody's illness was, the more likely they were to be affected by cost-related food insecurity. And as you can see there, for the very severe group over on the right-hand side, then there was a much lower proportion of people who were affected by cost-based food insecurity. And that probably isn't surprising, given that many people with very severe illness have got either supplemented food or are provided through the health service. Although it's not a negligible proportion. I mean, that's nearly a third of people with very severe illness still saying that they have got a cost barrier to being able to eat properly. So we then broke it down by each of those questions separately to look and see a bit more clearly what was happening. So here on the very first question, I've reframed it. So this is about now can't being able to afford to eat properly. So the people that we are most concerned about are the blue bars, and we're also very concerned about the red bars. So those are people who often or sometimes face one of these barriers. So as you can see there on the left-hand bar, half of people saying that they often or sometimes can't eat properly. About a third of people saying that often or sometimes food runs out because of cost. About half of people saying that they eat less because of cost. And a bigger proportion, about 2/3, saying that the variety of what they eat is limited because of cost. About 40% of people saying they rely on others, and about 20% of people saying that often or sometimes use food banks or food grants.
Can I just
So
ask a quick question on that, Mona?
absolutely.
The variety is limited. Is that that's variety based on cost or variety based on availability?
So the question is about cost. So the actual
Right.
question that they're asked is, are there times, and then you answer often, sometimes, or never, that the variety of food that you eat is limited because of cost? So how people interpret variety clearly must be quite different from person to person. I think it would make sense to think that, but the reason is always about cost.
Okay. Thank you.
Okay. And sorry, I should say feel free to ask questions at any point. I'm very, very happy to chat and rather than just talk. So just to illustrate some of those numbers, then you can see here the quotes from participants. People saying sadly, or someone said sadly, food is now a luxury item. At times I go without hot water. I turn off the hot water cylinder and heating so I can afford to eat. I feed my daughter and not myself, just so I can afford the things she needs. Somebody talked about the time when their food insecurity was worst. I had $10 a week to feed myself. And somebody else talked about being bedbound, unable to shop or cook, and unable to get to the door for deliveries. So I think these give you a sense of just how desperate some people are living and finding life. We then decided to look at whether people were able to meet the fruit and vegetable guidelines that the government sets, which is 2 or more pieces of fruit per day and 5 or more pieces of servings of vegetables per day. So we can see that up there. There's about 20% of people are never able to meet the fruit guidelines, and a bit more, nearly 30%, never able to meet the vegetable guidelines. So this wasn't specifically about cost. This was also more about accessibility. And when we looked by severity, then I guess it was not really surprising for the fruit guidelines was a very clear linear trend going from mild to moderate to very severe, of people there in the green bits of the bar never being able to meet the fruit guidelines. For the vegetable guidelines, slightly different. It was the severe and very severe people where the about half of people were not able to meet the guidelines, and it was less affecting those with mild and moderate illness.
Mano, did you pick up on intolerances at all as part of this, or is that?
No, it's a good question. We tried to, but in the end, the survey ended up being too long, so we took it out. But some of that does come through in the qualitative comments that people made about intolerances, but we didn't ask specifically.
Okay, yeah, that's it. I know obviously that's the number of people with severe, or on the severe side of the spectrum, do have some quite definitive intolerances, which would obviously affect their ability to be able to access variety, especially if cost is a factor. So
absolutely, yep, yeah.
Just
so
on
yeah,
that, Mona, can I have a quick question?
of course.
You said that limited availability of food is cost and also accessibility. Was there a question or an inquiry about the participants' choice on accessing nutritional food?
So choice about how they access
Yes,
food, do you mean?
they choose not to have 2 bits of fruit and 5 bits of veggies a day.
Yes, so no, we didn't ask that specifically. We did ask more general questions about where they were able to access their food from, whether they relied on pre-prepared food, and yeah, all that stuff is coming. But in terms of the fruit and veg, we didn't ask if that was a choice or not, no.
Okay. Thank you.
But there definitely were examples of people who wanted to be able to eat more fruit and veg, but felt it was too expensive. So somebody talked about being on special diets. This was both herself and her husband. We can never afford fruit and veg except for some frozen veg. Someone else said, I'm no longer able to go to a supermarket in person. It causes too much PEM, post-exertional malaise, and I order almost everything online, barring occasional help from friends. I miss fresh fruit and vegetables. Someone else talked about trying not to stress about meeting my nutritional needs because my priority is just to be able to eat. On very bad days, I'm too tired to chew food or drink, so just eating food is the best I can do right now. So that probably is getting a bit at that question that you asked, Phil, around yeah, how people aren't necessarily making an active choice about not eating fruit and veg, but it's more something they've been forced into.
Actually, it's really, I mean, it's really sad and quite heart-wrenching to read some of these comments, but to see that somebody's not able to go to the supermarket in person, that that's very black and white, that at least one of the services where you're providing really does meet a specific need. So that's
Hang
quite,
on,
that's
because
quite
you're
encouraging.
mentioned in the comments coming up.
Okay.
Quite a few people mentioned how superb your services are. So we then wanted to see what kind of trade-offs people were making if they didn't have obviously unlimited money. So were people reducing spending to be able to pay for food? So that was over 2/3 of people said yes to that they reduced their spending on other essential items just to be able to pay for food. And we then asked kind of in reverse, do people spend less money on food to be able to pay for bills and expenses? And again, over half of people said yes to that. So obviously people are having to make decisions in a very financially constrained kind of way about where their spending goes. And this isn't disposable income. These are basic things, food, bills and expenses. Again, when we looked over severity, then there wasn't a clear pattern about reducing people reducing their spending to be able to pay for food, although there was perhaps a slight trend there going from moderate to severe to very severe. And likewise, over on the orange bars, spending less on food to be able to pay for other bills, it seems like the very severe is perhaps a slightly different experience, and going from mild to moderate to severe, then people are having to spend less on food because of other bills. But again, it may be that some of these differences are due to chance, so we can't be absolutely certain about the trends that we're seeing. We asked people about getting deliveries, so we talked about ingredients deliveries, and then the question specifically mentioned things like getting a supermarket delivery, where people would then cook for themselves. And about a third of people said that they did frequently use or get deliveries of ingredients, and about nearly 1/5 of people said that they got deliveries of prepared food.
That's actually quite high, the prepared food. That's,
it is, yeah. And if you look
yeah.
here now by severity, the prepared food again is the orange bars. So if we look in the severe group, that's over 30% of people getting deliveries of prepared food. So I guess that also touches on the lack of ability to prepare food. It's not just about cost being a barrier. It's not just about getting to the supermarket being a barrier, but it's also about food preparation. So it's yeah, so about half of people with severe illness getting supermarket deliveries, and about a third getting meal deliveries. And so we asked this about regularly. We didn't ask specifically about frequency. So given these huge challenges, what do people do? Well, a lot rely on family, and some of these examples, without the support of the broader family or food banks, I would have even more health issues. My family have to provide food and other basic living needs for me, otherwise I couldn't afford to exist. My parents and other family members give me food. If my husband hadn't been able to work and keep a garden and a few sheep, then we would have struggled. A lot of people talked about relying on charities. So I'm bed tethered or housebound. I can't access community free meals, food banks or food pantries because none deliver. I do get soups and other items when available for West Auckland through ME Respite. This was life-changing. So just to reiterate just how amazing the work that you do is. I had to rely on soups delivered by ME Respite charity as I was unable to cook meals and couldn't afford to purchase microwave meals. I relied on food grants, Salvation Army, friends and family to get food. My CFS was bad enough that cooking was often undoable. And someone else just simply saying, I get food from the food bank. Other people had different coping strategies. Somebody saying, I always buy things that are on special because it's what I can afford, but often the food was off or spoiled and it would make me ill. Someone talked about having food grants. I limit my heating. I'm often cold as a result. I've considered foraging, but I don't have the energy. Somebody says I eat one meal a day at most. Someone else says I eat mostly baked beans. And one person said I've considered shoplifting groceries. So things are really desperate for some people. There were definitely additional costs that people talked about. So the delivery cost from supermarkets is a barrier for some people. So this person on the left talks about it being a huge barrier, resulting in having to buy less nutritious food because it's cheaper. So having to offset the cost of the delivery against the cost of what they were spending on the food. Someone else talked about alternative foods were cheaper. I'm dairy and gluten intolerant as part of my illness. That comes back to the intolerances of that often are associated with them, and that can be quite expensive at times. Someone else talks about not being able to afford the medical help or the personal help that they need. I feel like I don't count. I've been swept under the rug and forgotten. Alongside the questions we asked about food, then other people identified cost as a barrier to them maintaining their health as far as possible. I can't afford the supplements my doctor recommends. I have to focus on supporting my body to deal with the illness. but I can't do that anywhere near as well as I used to due to food cost increases not being matched by benefit increases. I'm unable to try diets such as low histamine that doctors recommend for my illness due to the cost. Someone else puts it quite simply, it would be a privilege to eat as my doctor recommends. So we then asked people to agree or disagree to whether they had any of these other strategies that they used or effects that they had due to their illness. So this is specifically because of their symptoms. So a small proportion who answered have a feeding tube. About a third of people say they rely on meal replacement bars or shakes. And about a third of people saying that because of their symptoms, sometimes they can't eat. Over 60% of people saying because of their symptoms, they eat smaller amounts than they would like. And about 65% of people saying I skip meals because of my symptoms. About 70% of people saying I eat a lower quality of food than I would like. And over 80% saying I eat a lower variety of food than I would like, again, because of my symptoms. So it's not only about cost, which is what we asked at the beginning, but also about the impact of the illness specifically.
So just understanding the starter, Mona.
Yeah.
So somebody might eat a lower quality of foods and they'd like also rely on meal and replacement bars and shakes, and also sometimes unable to eat. So that could be one person.
Absolutely, yes. So these can't be added up over those bars. Yeah, each one was a yes or no. They could answer yes or no to. And not surprisingly, then this amount of difficulty does result in stress. So people were asked about stress in the last 12 months because of not having enough money for food, and these were the second two questions. The second set of questions, the last two that the New Zealand Health Survey specifically used, talking about stress. So 20% of people saying, I often feel stressed because of not having enough money for food, and another 40% saying, I sometimes feel stressed because of not having enough food. And similar proportions of people saying they feel stressed because they can't provide the food they want to for social occasions. But it's not just about stress. Lots of other emotions came out. We talked about, people talked about the guilt they have in asking, the shame and the stigma. If I'm unable to afford decent food for the week, I will go without meals rather than ask for help. I'm too proud to ask for help from the neighbours, although the lady next door checks on me regularly and sometimes brings a container of soup or a bowl of chips. My family provide for me, but this leaves me feeling guilty that I can't contribute more, both to the purchasing of food and its preparation. This is such a heavy burden of guilt that I carry. So yeah, just to summarise, then cost is clearly a big barrier, but it's not only cost, it's also about the ability to shop and prepare healthy meals, a significant challenge for people with ME or long COVID. And I think it's important that when we disseminate this, then I don't really need to say this to you, but to other people who understand the illness less well, then there's a unique combination here of barriers to healthy nutrition. So there are the sensitivities, there is the lack of ability to prepare food, even if food is affordable and accessible. I think that this yet again reinforces the need for ME and long COVID to be identified as disabilities, and the role of informal carers to be recognised, and not just carers, but also carers in terms of providing food and nutrition. And in some of the feedback then we've got, then people have asked us that we specifically recognise that ask GPs to recognise that nutrition is considered when they're considering holistic care of somebody with one of these illnesses.